Okay, let's get started. So good morning. We are from HealthDox, and today we are going to be talking about HIPAA compliance for business associates in the healthcare organizations. We'll look into the liabilities, contracts, and oversight and their impact. A few months back, we had covered the topic of HIPAA compliance for covered entities. So today's topic is going to be solely for the business associates. So we remember a brief history of HealthDox. We have 25 years of experience. We started off with policy management, and now we have built a brand suite of GRC solutions, going all the way from incidents, policies, to compliance, contracts, and so on. So we are a member of HCCA. We have been to the trade shows of HCCA, Ashram, and so on. We are expanding in AI rapidly. So we have the traditional solutions for those organizations that are still wanting to remain non-AI. So we do have the AI version separated out as a pro package. So AI is in the incident side for the predictive analytics and so on. It also helps with compliance management. We also have certified auditors and consultants who can come and audit if you're doing an ISO 9001 audit or 27001, you name it, any different versions of audits. And here we have our presenter. I would like to introduce Rupa, who is our risk advisor at HealthDox, and she has experience in various different organizations before she started off in healthcare. So she has aerospace and embedded software. So basically, she has been in the compliance and quality side. And with several certifications, an expert in Six Sigma black belt as well. So you have a good speaker here today. So let's go through the agenda. We are going to be talking about HIPAA enforcement snapshot to give you an idea of the current scenario on the situations that are occurring around us. Then challenges for the business associates. What do they occur? What are the current challenges today? What does BAA Essentials cover? And the liabilities and risk exposure. And the BAA agreements, oversight and auditing best practices, and enforcement and penalties. And you can use the chat box at any time to ask us questions, and we will answer them at the end. We also have polls throughout the presentation, so please actively participate in the polls. Okay, let's get started. So what are the current HIPAA enforcement snapshot? Like, what are we dealing with, right? So there have been a few breaches in the recent past. For example, the recent enforcement actions and proposed updates highlight that how critical and what is the need for a stronger HIPAA compliance, risk analysis, and technical safeguards, right? So we wanted to bring your attention to the current issues that different organizations have faced. And the first one was like a ransomware attack, and it exposed a huge amount, like 580K plus records, which is a big deal. And the OCR settlement reinforces that BAs are directly liable for PHI breaches. So a BA has to be extremely careful in this area. The second one was again a lawsuit, right, with inadequate safeguards, which was again a ransomware data breach, and which was encountered by a healthcare organization. And this was due to, they were sued because of the weak BAs and missing safeguards. So this increases the legal risks. So our agreements need to be enforced. So when there are missing agreements, the legal risk is high, right? And HIPAA risk analysis, another one where OCR cited 7 cases where there were poor or outdated risk assessments, so which led to incidents. So regular detailed risk analysis is expected. It's part of the system's procedure that needs to be followed. Also, this last one here is we need to have asset inventories and such, because otherwise there is a risk to the HIPAA security rule update. So there was a proposed rule update that happened. so that people concentrate more on their encryptions and incident response, and how 24-hour breach notifications should happen, and emphasis is shifting from policy to taking action, real-time action. Okay, here we go. We'll have the first poll. It will come up on the screen in a second. So if you can actively participate in the poll, please. The poll is in progress. It might be up on your screen. And yes, we are collecting responses. Thank you for your participation. Okay, we'll give it 10 more seconds for more to vote. Okay, so I see 2 of the categories being the most answers to the, okay, 62% got it on mostly, but a few need update. So you guys are aware of it. That's good. And then 38% said all are current and compliant. That's very good. Good to know. So you're on top of these. Okay, let's go ahead with our presenter.
Thank you, Harita. So some of the key challenges we have seen while working with us as part of business associates, increased liability exposure. The HIPAA Omnibus Rule 2013 primarily says that the accountability and responsibility of any kind of breaches also equally goes or with business associate also. So that way we make sure that the agreement or the contract, what we have it's very much valid and up to date. Outdated or incomplete BAs, like I said, for various reasons, there may be the business dynamics would have, occurred, which would take course. The BAA should make sure that the agreement is up to date kept, and also any kind of changes or amendment is also made according to that, making sure that both the parties, covered entity as well as business associates, are in sync with their expectations. And coming to the technology, it could be cloud, or it could be on premises, or it could be any other way of dealing with this infrastructure. Adding this technology complexity, it's more and more nowadays because the distribution is of healthcare business is so much. It adds very much complexity in determining the scope of the services and the business process and everything. So that all should be kept up to date. And missing risk analysis.
Thank you. So here we go with the second poll. Let's launch the second poll. What's your biggest challenge with HIPAA compliance for business associates? So is it tracking, maintaining them, verifying the vendor security practices, ensuring timely breach notifications, lack of internal resources, or is it all of the above? Okay, here we go. So yeah, we got the highest vote on all of the above. I think that makes sense. There are issues everywhere that we need to be spending time on, which is challenging. And there is like 15% each were on the other 3 categories of tracking, maintaining BAAs, verifying the vendor security practices, and lack of internal resources. Those are all divided. And 53% was on the all of the above. So good, thank you. So we'll continue with the presentation.
Thank you. Some of the critical expectations that should be part of the business agreement is, these are the few line items we have put up here. So most important thing is, what are the different safeguards should be implemented at business level? It could be administrative safeguard, or it could be management safeguard, or it could be technical safeguard. So depending on the scope of the service, business associates should do the risk analysis, make sure that necessary mitigation plans or the safeguards are implemented in line with HIPAA expectation. And also the breach notification, it should be clearly called out in the BAA that what sort of the breaches will be responded, or what part of breach will be reported to this covered entity, what is the timeline, at least different things about the incident reporting timelines. All this should be part of your BAA agreement. And subcontractor, for various reasons, we would be having the subcontractors or the third parties involved in our business processes. So even though he is a part of the covered entity, but he should make sure that he is also having the necessary compliance requirements as per the BA agreement. He should be notified the covered entity, get his buy-in, get his consent, then you go for implementation of the necessary controls on medication plans with the subcontractor. And also destruction, finalize, return of the PHI. In case of any business gets terminated for various reasons, how are we going to handle the PHI which is accessed or which is stored by the BA? And all of things also should be very, very critical in determining the scope of service and also determining how do we handle in the compliance aspect and part of it. And audit rights. So covered entity obviously will be having the various audit rights of a business associate and also contractor. So they should be clearly called out during the what circumstances audit will be held, who is responsible for it, and also on. Some of the common mistakes we are seeing, no BA in place. There may be the high level agreement or statement of work, but recommended BA may not be there in place. And some of the outdated one also be there because we would have signed the BA a long time ago, maybe 3-4 years ago. For various reasons, there is a scope of service change, various dynamics would be there, but BA wouldn't have got changed or amended. That is very key here. And some of the entities we have seen, they are assuming that for everything that happens, covered entity is responsible. It is not so. Even business associates are also equally responsible and accountable for whatever happens in their business area. So these are the few things we have seen as a mistakes we are in the industry. Thank you. Go ahead.
Yeah. HIPAA does not just apply to either cover entity or it's not just for the direct vendors like BA, but it also, as we previously said, it also has to flow down to any subcontractor to whatever level they are, who uses the or who handles the PHI. They should also comes under this HIPAA compliance program. So as a business associate, you will become responsible for ensuring all your subcontractors follow the same rules as you are following. So that means they must also sign the BAA with you as a business entity and not just rely on the agreement what you have with your covered entity. So the bottom line is the subcontractors also has to execute a BAA with the business associates. And being a business associate, you should make sure to extend to all downstream vendors this BAA. And also you need to conduct a due diligence before onboarding any vendors. Always you should ask vendors who else touches our PHI, then verify the BAs and all security practices are in place with those subcontractors and vendors. So we have to think like compliance must flow down from the covered entity to BA and to every subcontractor. Okay, let's see talk about what is critical aspects in vendor management. So the main thing is always we should remember that vendor oversight is one of the most overlooked, though it is a high risk areas for any business associates, but this is often overlooked in most of the cases. So once PHI is shared, your responsibility as a BA doesn't end, but you need to monitor how your vendors handle that data over time. So start regular vendor risk assessment for every partner who is having access to your PHI, and you should require proof of HIPAA training from them, not just during the initial onboarding, but also regularly you should check if they are undergoing the updated trainings. And use a vendor oversight checklist to make sure they stay compliant, especially helpful during audits and investigation. You can make use of those checklists. And also you can maintain the incident logs as a proof, so that you can check the security practices and their incident logs to make sure the contract status all are in place at least once in a year. That is very much critical. So we have a quick poll.
Yes. So how often do you audit or review your business associates' compliance? So annually, what is the frequency? Okay. I'm seeing most of them is annually. Some of them is only when onboarding or renewing. Okay. So majority is annually. And yeah, it's like a 75-25. So 75% is annually, and I think it's ongoing. So 60% are saying it's annually, and then 40% is only when onboarding. Okay, going ahead and closing the poll. Let's move on.
Thank you. So yeah, annually it's required, and frequently, as much as possible, you need to do that oversight. Okay, so the key for the success of BA staying compliant and ahead of risk is the strong oversight. So it's not just signing BAA, we will be done with it, but we must actively oversee our vendors and subcontract every time as we are a BA. So start with the vendor risk assessment before onboarding, and not only during the onboarding, but look at access to PHI, security portion, breach history. Based on that, keep doing the vendor risk assessment regularly, at least annually once, to make sure it's up to date. And outdated agreements are one of the top findings in any OCR investigation. So that means, so we have to review our BAS very regularly to avoid this risk of outdated agreements. And you should have a clear oversight policy defining how often we will monitor vendors and what to check for. So that should be covered in a oversight policy. Schedule internal audits at least annually. So focus on access logs, breach handling, or staff training, things like that. And also keep an audit trail, so that document your actions, decisions. This will be helpful during the audits, and whenever there is some inspection happens, we can make use of this audit trail as one of the more critical evidences. So you can consider using a compliance dashboard, so that it helps to track all key performance metrics related to this BAA and our subcontracts, everything in one place, so it reduces the manual effort. So I have, this is, though it is not mandatory, but it is recommended that as a BA we can assess ourselves, and also we can assess our subcontractors using this HIPAA oversight and auditing maturity model. And this can be used by covered entity also, but since the scope is for BA, I would recommend using to self-assess the BA as well as our subcontractors. So this maturity model, as you all know, the level 1 will be ad hoc, and we will not have any oversight, or I would say little structure at level 1. Level 2, as you all know, it's a basic one, which means you have some process like signed BAA, but no consistent review happens. At level 3, you are doing scheduled assessments and have formal vendor oversight policies, but that is not sufficient, because you need to track the compliance systematically with logs, audits, and documented reviews, so that you would be striving to continuously improvement your compliance program. So finally, the level 5 is the goal. which is called optimize level. We use dashboards, real-time alerts, and more strive to more continuously improve our compliance. So all integrated into an operations. So this model, as I mentioned, it helps you self-assess, or you can use for your vendor assessment also. So here just an example how HIPAA oversight dashboard can help you. So you can see, start with BAS status tracker so that you can know like how many agreements are in signed status, how many are expired or missing. So those information you can get it. And as I said, integrated dashboard always will help to know everything in one place. Like using a vendor risk heat map, it can focus on high risk vendors that handle the sensitive data, and visualize the training completion data through training completion and audit trail. So you don't need to build everything from scratch, right? In industry there are many tools are available like Power BI or Google Data Studio or some third party tools, so which would help you bring up this dashboard and help you make sure the compliance dashboard is visible to you so that you can take appropriate actions.
Thank you, Rupa. So how HealthDox can benefit you? So we specialize on governance, risk, and compliance products, which actually empowers the business associates to reduce liability, maintain continuous audit readiness, and build stronger partnerships through a unified, intelligent approach to compliance, right? So we also simplify complex governance and regulatory demands. This would enable you to focus on growth without compromising on trust or accountability. HealthDocs also supports recognized accreditation and certification standards like ISO 9001, 27001, and so on. This reinforces your position as a reliable and compliant healthcare partner. We also have been expanding at a fast rate in AI. As I said, we have traditional as well as the AI Pro assisted package, which helps the business associates streamline their contract reviews by identifying the risks and tracking key obligations automatically. It also enhances the HIPAA compliance through continuous monitoring, risk assessment, and timely policy updates as well. So here is our GRC solution suite. As we say that, as I said, contracts, compliance, HIPAA, all those would definitely benefit the BAAs. And these together, like we take this unified approach on why we have all in one suite is the data is shared. This integration actually helps reduce operational silos, where ensuring the risks, obligations, and incidents are managed consistently across your organization, so that you don't have to have a risk department be siloed from the compliance department, because everything is a risk eventually, right? If you didn't take action, if you didn't do the right actions in the compliance side or in the contract side, it would result in a risk. So you can work as an integrated organization with integrated solution. So this enables and strengthens your audit readiness, and it minimizes the chances of having any regulatory gaps or missing any deadlines during your audits and so on. So here we go. Here is our contact information. And do you have any questions? Are there any questions on the chat window? Okay, so here we have, will the slides be shared? Yeah, if you can send us an email. Okay, I got your name. Yeah, we'll be able to share the slides with you. If you can actually send me an email at, I'm not sure if my email is listed. Let me add it in the chat window. Okay, in the meantime, I'll ask the question that came up. Another question: how often should we review and update our business associate agreements, especially with long-term vendors? So,
Okay.
Rupert, you want to take that? Yeah.
Yeah, that's a good question. So I would recommend at a minimum annually you should do it, or whenever there is a change in the services of subcontractors, or when there is a significant regulatory change, we should do the we should keep reviewing and update RBA.
Okay, cool. There's another question. If a subcontractor of our business associate causes a data breach, who is held responsible under HIPAA?
So under
Under
HIPAA,
HIPAA,
yeah,
yeah,
go ahead.
Under HIPAA, like I said in the previous slides, both of them are held equally accountable in case of any breach. Business associate or as well as covered entity, both are equally responsible and accountable.
Yeah, and just to extend the answer, so it is, if it is a breach from the subcontractor level, then both the direct business associate as well as the subcontractor will get held responsible for this breach.
Okay, thank you. But it's in the hands of the BA, right, to be assured and keep it safe. So you guys are powerful, and with power comes great responsibility. Okay, here we go. So yeah, you can let us know if you have any questions, and we'll be able to send the slides as well. If we have all your emails actually, so we can send you the slides to Margaret. Yeah. Okay, there are no other questions. So thank you all for joining, and have a nice week ahead. Bye-bye.
Yeah, thank you all.
Thank you all. Have a good one.